It's enough of a visit that we can do face-to-face through technology instead of in person. So it's we're able to actually continue care by maintaining that relationship virtually. Instructions are arranged. You get an emailed invitation for Zoom, which is the platform that we're using, but we can use FaceTime as well. When your time comes for your appointment, you get into about 10 minutes before, a nurse will call and review your history and medications, make sure that your chart's all up to date, and get you ready into a waiting room, a very small waiting room in your living room. And then once your time comes, then the visit starts with your providers.
How are you feeling since your last visit?
I'm feeling a lot better, actually. I still have a couple concerns.
During that 1 day period where we were monitoring you, we didn't catch any abnormal rhythms, but you also didn't log any symptoms that day.
So how long am I going to be wearing this for?
So really, based on the frequency of your symptoms, I'm actually recommending a 30-day monitor, so for a full month. For the most part, most patients are sitting on their couch in their living room or in their kitchen, and they are actually being seen quicker, and they're getting the questions answered. I think a really important part of all this is really talking to patients and trying to understand their symptoms. A lot of times I've heard patients feel, and this is my own experience as well, that sometimes we don't spend enough time listening. And with this technology, it's actually vital that we listen. We can examine a patient, we can review data, and we can review home vital signs if patients have their own home blood pressure monitors and heart rate monitors, but we don't get to physically touch our patients, which is a new thing for most of us. There are some limitations, but for the most part, we can actually review any x-rays, EKGs, echocardiograms, or any other imaging prior to the visit, and we can actually at least understand what symptoms are ongoing, what symptoms have improved, if there are any new concerns, and then come up with a good follow-up plan for the next visit. We typically are getting our referrals through primary care providers. We have had some self-referrals, and I do go over every request with my staff. We do have some protocols in place, and if patients are willing, I think the first touch point really is a nice one to do via virtual meeting. And then we can determine if it's really urgent to be seen in the office thereafter. I think this technology is allowing us to still provide excellent care, but minimizing travel outside of the home, which at this time is still, it can be dangerous to your health.